So wonderful. Good evening, everybody. I'm Pietro Paganini, and I'm the chair today and your host for this new series or new event of the series Austrian Economics Monthly. And let me remind or remember where we are coming from, because this is a new event, a new series that we started back in during the lockdown. We were supposed to meet with the Free Market Roadshow in June in Italy, and because of this little virus or animal, as you want to call it, or being called COVID-19, we had to cancel our event, the Free Market Roadshow in Rome, but we decided with the Austrian Economics and Competitor to organize a series of seminars, and they went well, and then we transformed them into a series, the Austrian Economics Monthly. And here we are. This is the first event of the year. We start every Thursday at every last Thursday of the month. So the next one will be the end of February. We haven't decided the topic yet, or maybe they have decided in Vienna and will come to you with a new invitation. Today, we are talking about a very interesting topic, a new topic. We discussed somehow about sustainability and food. Today, we are going to focus exclusively on food, and particularly about something quite interesting. In fact, we call it a war against three ingredients: being fat, being salt, and being sugar. And of course, we can enrich, unfortunately, this list and make it a bit longer, but we just stop here with the three key elements that are fat, salt, and sugar. And again, there's something going on out there in the real world to sort of reduce the use of these ingredients. Question is, are they really bad? Are they not bad? And to be honest, we use them, we need them as human beings, and it's very important. In some cases, in some parts of the world, if you think about the Western part of the world, we take too much, perhaps, of fat and too much of sugar, according to somebody. In other parts of the world, there is a lack of fat, sugar, and salt consumption. Actually, they need more. As the World Health Organization said, we need a certain amount of fat, salt, and sugar every day, but then it's not too much every day. So we see how much is this not too much. We start with a couple of questions. And the first question is this war against ingredients or against nutrients an ideological war? This health consciousness, where is it coming from? And why are we experiencing, particularly in Western world, this negative approach to this or against these ingredients? What are the policies that we are experiencing today? And what kind of policies do we need? And we look at this from an interesting point, a more technical, empirical point. And therefore, we have put together a beautiful panel. And let me start introducing them very briefly. I'm not pronouncing the bios because you can find them on either the computer.eu website or the Austrian Economic Center website. But let me start introducing Natalia Gonzalez. This is our guest from Chile, from Libertad and Desarrollo. And then let me go on with Chris Snowden from the Institute of Economic Affairs, Antonio Omuloni from Civismo, and then Andrea Poli, Dr. Andrea Poli, who will provide a technical and empirical evidences on fat, salt, and sugar. I also want to introduce what would be one of the last points that we're going to touch. The fact that today with technology, and Andrea would probably touch on this, on technology, we can personalize diets. So if we can personalize diets, is there really a need to make a war against these ingredients? But let me start. Is this an ideological war that we're seeing, that we are experiencing? Chris, the word is to you. And before letting you talk, and as you know, I'm Italian, I tend to talk very much. Don't forget that we are live on Facebook. We are live here on Zoom, and we are, again, being recorded. So everything that we're saying is being recorded and is going to stay online forever before we get censored by YouTube or somebody else. The word is to you, Chris. Please go on. 5 minutes. We want to stay in the 45, 50 minutes. We usually succeed. Let's try today. Chris, the word is to you. Chris, Antonio, Natalia, and Andrea. This will be the order. So Chris, the word and the floor is to you.
I mean, it's ideological in the sense that the public health movement is ideological. The basic ideology is paternalism. We are living now with a genuine public health crisis around the world. We're all locked down because of a genuine public health crisis. And it's a genuine public health crisis because it involves infectious diseases. And libertarians might have different views on how to deal with that, but hopefully we all accept the harm principle and the idea that spreading a virus around is a very different matter to eating too much fat and sugar and possibly becoming obese. The modern public health movement takes a different view. It sees any health issue that affects large numbers of people as being a public health issue, even if the health issue is the direct result of individual choices and the health consequences only affect the individual. So that's the ideology of public health. And I think it is an ideology. When we're talking about fat, sugar, and salt, well, why have they picked those particular things? I think you have to trace a lot of this back to the war on smoking, actually, because that is seen as the great success story in public health in the last 30 or 40 years. And with smoking, cigarette smoking specifically, you had a very specific activity linked to a very specific disease, lung cancer, other diseases as well, but particularly lung cancer. And it was pretty much axiomatic that if you reduced cigarette consumption, if you reduced the number of people who were smoking, you would reduce the number of lung cancers, you would reduce the number of smoking-related diseases by definition. And that was relatively straightforward. Okay, it took decades of bullying smokers and making cigarettes incredibly expensive and stopping people smoking them anywhere. But the basic cause and effect, the basic principle was fairly straightforward. Then you find another public health problem. Lots of people are getting obese. Lots of people are getting diabetes. Lots of people are dying before their time in a similar way to smoking. How do we deal with that? Well, actually, it's much more complicated. It's far more complicated because you can't isolate a single product to blame it on. You can't even really isolate a single industry to blame it on. We hear now about big food, and that's a direct echo of big tobacco, but it doesn't really mean very much. I mean, people can quite easily get obese by shopping at small food companies, you know. And so the question for them was, how do you deal with this much more complicated issue? Most of which is actually down to physical inactivity, for which there's no industry you can blame. There's nothing you can tax. There's no advertising you can ban for people sitting around on the sofa. So that side of it was completely left out, and we focused entirely on the calories in the food. But you still don't have a specific product to demonize, a specific business to demonize. And so we had this idea of high in fat, sugar, and salt, or processed food or ultra processed food. And we're going to try and pin the obesity problem on that. And that's where certainly the sugar and fat come into it. The salt doesn't actually come into it at all, funnily enough. There are no calories in salt. Actually, putting salt in food is a pretty good way of making food tasty without adding calories, as it happens. But of course, there are health implications with eating a large quantity of salt, which predate concerns about obesity to do with heart disease and hypertension. So to conclude, they wanted to treat this issue as if it was as simple as smoking, where you just isolate and pick out what you think is the cause. You blame businesses for producing the product rather than blaming the individuals for consuming too much of it. And you try and tax and ban your way towards good health. And it's not working. And one of the reasons it's not working is because it's far too simplistic. It doesn't work like that. Food is essential for life, obviously. You can't force people to run around or take exercise, which is a very large part of the problem in affluent societies. And people's demand for tasty food is pretty inelastic. It's very inelastic. People will quite happily forsake other things in their lives and make cuts in other areas of the household budget rather than pay more for the kind of food they like. So it's not working, and it won't work, but we will see a whirlwind of destruction and legislation before any government finally holds their hands up and admits that they can't control the waistlines of their population.
Thank you, Chris, so much. And you touch upon very important points. The first one is, a rumor that has been going on for a while, said by some people, particularly in Brussels, food and beverages will be the next tobacco. Okay, and we're kind of seeing that kind of attitude against food and some beverages, particularly. That's the first point. Then you touch upon obesity, and I wanted to move to Antonio, that is in Madrid, and in Spain, and according to Antonio, that, by the way, Victoria, Antonio has a presentation, so please, Antonio, you can start sharing it, and Victoria should help and allow you to go with that. Well, according to the World Health Organization, Spain is one of the healthiest country in the world. So I'm wondering, is this obesity problem a real problem? Is it a problem everywhere, or is it just a problem in some parts of the world, the West world, but everywhere in the West world? And is everybody at risk of obesity? And this is an issue that I think we should address. The other one is very important that you touch is upon our lifestyle or our behaviors, mobility, for instance, the fact that we don't move or our kids are moving much less or consuming much less than we were. Antonio, I'm going back to the original question. Is this an ideological issue? Is there a real issue against the three ingredients? Or as we said, it's just health conscious trend that is invading the market that, by the way, is forcing most of the time food industry to change the flavor, the formulas of their products. And that, I'm always concerned about the taste. When I see a good product and then fat is reduced, usually the taste changes as well.
Well, thank you, Pietro. Thank you all. I think that's the question. Sometimes I think is it rhetorical question, but well, I would like to share what's going on in Spain to address the question, because I think it's, as you said, we're a healthy country, but we're always under this kind of, let's say, threat. So I want to go quickly through it just to have time to discuss for the discussion. But first of all, just a bit of context. Since January the 1st, just a few taxes have been raised in Spain. And as you can see, these are not all of them, just a few ones, and they are not marginal taxes. They are a bit important ones. So it's funny fact, well, not too funny, but the current government of Spain is, as you know, is a very far left government, and they, even before assuming that they always stand that the burden of the crisis would have to be supported by the rich, as they said, but according to their taxation policy, the fiscal policy, it's hard to say. But let's focus on our topic, and sweetened beverages is among those taxes that has been raised since January the 1st, and it has raised from 10% to 21% VAT, straightforward from one day to next. What does it mean? That means, well, a 2-liter bottle of soda, of Coke, it's has raised from 150 to 175 euro in 24 hours. So, which is, it makes an impact on the citizen, on the man of the street, on the street. So, but having said that, the question: does the government care about health, really? Well, if we go straight to the source, the Minister for Consumers, for Consumption, said just a few months ago that, well, literally, I quote, childhood obesity affects 23% of the families with the lowest income rates and 11% of those with more resources. So they know their policies are affecting the people they mean to defend, to care about. Okay, they may care about them this way. Probably, I have to doubt. But let's go through. We don't know what's going on with what's going to be the outcome of this higher tax now. But here in Spain, we are lucky we can somehow foresee the future, and because, well, Catalonia is leading the way, and they changed it 3 years ago when for the consumer it was around 20% higher price per liter of drink, and according to the regional government, the reduction was around 20% also. But if we go to the public income, the forecast was always way higher than the actual income. As you see, in 2018, for instance, it was basically half the amount. So it's always, I mean, is it about health? Is it about income? I wouldn't say it is about any of those. Let's go a bit forward. So, and it was recommended by the WHO, by the way, which is important. So, and talking about the WHO, the World Health Organization, it's been a bit tough on Spain when it comes to taxes on alcohol, which is a substance we're not talking about now, but the effect is similar in terms of elasticity and in terms of a very important factor, which is addiction. So talking about the WHO, there is a global strategy to reduce the harmful use of alcohol. It was written in 2010, and it was applied in regionally, of course, in Spain as well, and it's basically based on taxation and prohibition. When it comes to Spain, it's basically taxation on beer and spirits. Since we are a strong wine producer country, especially when it comes to land, we are the first one in the world in land, not in quantity, not in price, but in land. So the taxation on wine is lower. So this is the funny fact. When habits really change, they don't change because of taxation, and especially when it comes to these kind of substances. As you can see, and this is according to the World Health Organization, from 1960 to 2015, the alcohol per capita consumption just plummeted, and it's a clear trend. And there's nothing to do with those plans and those global strategies that try to change habits. It will go to the change in population from the countryside to the cities. There is a huge parallel. There is a strong parallelism among those both factors, and especially among three, because if we look at wine, this is exactly parallel to the whole to the whole alcohol consumption. So people just move from the countryside to the cities and change their habits, their way of life. They didn't drink as much wine as they did in the countryside, as our grandparents used to do. And now we just drink less. And there's no relationship between consumption and taxes, especially wine is the cheaper one, and is the only one which is lowering. So, having said that, do they focus on health? Well, it's hard to say, especially from a government who cares about the poor, and their fiscal policy affects everyone, especially the poor, and do not really change habits, which is hard to say actually, and probably soon to say, but probably we cannot say it will. But it's not so hard to say one thing. All of these policies focus on substances with something in common, which is they are addictive. So they are hard to get rid of for people who, especially for those who are in the lowest strata of income, who are less for those who saving is harder, and there's no incentive to save. So answering just your question and treating to answer your question, especially with regard to Spain, well, it's hard to say that they care about our health instead of higher incomes, and especially controlling lives. Thank you.
Thank you so much, Antonio. Thank you so much for bringing into the discussion Spain and bringing important data to here to us. And you mentioned the consumer ministry that you have in, and I'm always intrigued by this name. And I know that Spain is the country that wants to introduce the Nutri-Score, and that's another trend that we are foreseeing in Europe. So it seems that Italy is the only country that remains out of the Nutri-Score. There will be this big discussion in Europe, I guess, very soon around these little trophy lights on our products. But because of what you mentioned and the data you mentioned, one of the countries that has implemented probably the toughest and strictest regulation on food, and particularly on the labeling of food, is Chile. And we are so proud and so happy that we have one. I have a conflict of interest, I have to say. Is a great friend of mine that is here with us, that is Natalia. Natalia, tell us about Chile and whether all this a war, we can say, also in the way it has been deployed with the black dots on labels, they're kind of scaring. Did it work or not? Because if I remember correctly, a few months ago or before the pandemic, the minister himself said, doesn't really work. Am I right?
Yes, thank you, Pietro. Let me start from a little bit previous point of view, because maybe not everyone is aware of. Like in 2016, Chile passed this law that regulates the labeling on packaged food. The Chilean model proposes a very, very strict and explicit system of labeling. It requires that the products that exceed certain nutritional limits, which are very demanding, by the way, will have to have like this front of package black warning message that it's inside like a stop sign, which reads high in. And so you will have high in calories, high in saturated fat, high in sugar, high in sodium. These limits are set on critical nutrients that are based on a 100-gram portion, which is not necessarily the consumer portion in every scenario. And those limits have become progressively more strict. On 2019, they became stricter than they already were. And you must note that Chile limits are quite stricter than others of other countries. So it's not only the labels, this black signs, it's also we have very strict regulation regarding advertising this food that is qualified as high in. So for example, if you want to do advertising of, I don't know, chocolates or cookies or whatever of these products are usually high in sugar, and you're addressing that advertising to 14 years old or younger, you have several restrictions which you cannot do. There are scheduled times where you can pass these advertisings in TV, in the cinemas. You cannot have this kind of products at schools. So the regulation has become very strict. Now, what people say usually, and especially health advocates, is that this black stop sign is quite simple, and that simple is great because it's easy for everyone to understand. Like you see that a food has this sign and then you just discard it, you know? But although I tend to believe that simple is really a great quality usually, in this case, simple does not mean right. And we can comment further on that because one of the things that is now being assessed in this policy is the characteristics of this specific symbol, which is black. And you know, black has a correlation with hazard, with poison. So it's a very symbolic kind of seal. As our friend from Spain was saying, it's not only the seals, we also have fiscal policy regulations regarding sugar. We have also passed a specific tax to non-alcoholic sugary drinks, which in 2014 were increased in 5%. So now we have from a 13 to an 18% tax in sugar drinks. And the effects are somehow similar to what our friend from Spain was saying, in the sense that the big impact has been assessed in high income households. Lower income households have not decreased their consumption of sugary drinks, with of course, having an impact in what they are spending on those drinks. So what we can see in Chile is that in the past 5 or 6 years, sugar has become the dietary enemy #1. Once it was saturated fat, the archvillain, now is sugar. And I think we have to reflect on this a little bit, especially because health advocates are posing very optimistic conclusions about the impact of this very strict policy in Chile. I'm not going to say here that it doesn't have any positive impact. It has raised an awareness, consciousness, but it has also arisen a lot of queries and questions and doubts about this public policy impact. And I think we have to especially consider those because Chile is somehow being like the role policy model for labeling in Latin America. Colombia is looking at us, Ecuador, Mexico. And if any of our friends in those countries are here in this seminar, I would just tell them to be cautious at looking at our policy, because what has happened here really is that people are less incentivized to assess the policy. We want to transmit a success history because it's a regulation that makes the politicians feel very good about themselves. I mean, senators that have pushed this regulation have won prizes and recognitions from the same international organizations that were once pushing for this regulation to become in force in Chile. So it's the kind of regulation that makes politicians feel good. And when that happens, the disposition to review the impact of the policy is diminished. And that's a problem. That's a problem when, as I was saying, we're being looked as a role model. And this speech of success is like a perfect fit to maintain the status quo. And that's what I don't want to maintain, because the regulation has several problems. And we can enter into those details afterwards. But I think the main problem or the main flaw of this kind of regulation is conceptual, Pietro, because instead of educating or promoting healthy habits, the law is prohibiting certain food in certain places. You cannot sell this at schools. You cannot sell them or freely give them to certain people like minors. And we are actually punishing the consumption of certain products with a pretended social disrepute without really achieving it. And we're not even achieving it, the objectives of the public policy was to reduce obesity. So when you say these things, especially in my country, your arguments are discredited, because they're discredited because you're an interested party, or you're a part of the industry, or you have been captured as an academic by the industry to reveal these flaws. And I think that's a very unlucky trend. So the problem here, Pietro, as I see it, is that what people want us to think about food is that it's not only about food. Like, these politicians not only want us to eat what they want us to eat, but they also want us to think what they think. And we cannot have a different opinion, because if we do have them, we are in the politically incorrect side of the story. Remember, we're telling this success story, so you have to be in this side of the road, not in the other one. So I think what we really need to ask here is what's happening with healthy habits consumption. I think that in a free society, and with this I'm closing, those habits are really formed through education, through conviction, through responsibility, through the effort that every one of us has to do, which is really shaped individually or by every family and at schools. But instead, we are replacing this by this police state that will persecute consumers, discrediting them if they buy this foods that have these black signs, or we are discrediting the industry or anyone that's trying to pose questions. And I think we cannot hold that as a long-term solution. I think it, moreover, it damages the individual and family incentives on the long term as to their responsibilities in educating themselves and their kids in healthy food consumption habits. So unluckily, Chile has gone into a path where it's all in the state, nothing out of the state. And that is not what we should aim for, but that's where we are.
Wonderful, Natalia. Thank you so much for being here with us, particularly for interrupting your summer holidays, because in Chile, it's summer, lucky you. You have COVID, but at least it's summer. Here we have COVID, and it's actually winter, and a very bad winter. So thanks a lot. Let me thank also our crowd, the one on Facebook and the one here on Zoom. Particularly, I see the one from Asia, and it's very late in Asia, very early in America, but very late in Asia. So we are really global. Let me go to Andrea. And Andrea, I know you have slides, so please start sharing the slide. Victoria is back here, so she should allow you to share the slide. Let me know if they work. Otherwise, I will come in and help you. One thing that has kind of come across, Chris, Antonio and Natalia, is some kind of the moral role of the state, the fact that the state or governments tend to tell us what we should eat or not. But on the other side, you know, I have to come here with the other story is, well, people pay taxes, we go to hospitals because of obesity, blah, blah, blah. So the government in a way should provide us, and Natalia says correctly, with education. But here we have a couple of questions. One for Andrea. First of all, whether is there whether it or not there is an obesity problem, and then something very important that Natalia has just said: the fact that these public policies often are not reviewed. We don't know whether they work. We pretend they work, or we just get excited because we have public policy, but we don't review them. So, Andrea, please try to help us from your medical perspective and medical experience, many years of medical experience, what is going on with this work. And I guess you cannot share the slide, correct?
I don't.
I see from your face. Now I am a good moderator, I can recognize.
What can I do? I don't know where to click.
On where you have condivisione. Sorry for my Italian.
I clicked on share, yes.
Yes, and you should see them.
I don't know what to share, actually.
Your slides. Lack of sugar. That's a clear lack of sugar, Andrea.
Okay, I think it doesn't work, definitely. Okay, so I'm sorry because it will.
You want to send me the slides quickly while you start talking?
I think I will try to do.
You didn't do that, but you know, I fail my students when they don't do it.
Okay, so let me start from your the question you posed us at the beginning of this conversation. Is this ideological or scientific-based war against fat, sugar, and salt? I think that it's largely ideological. I wanted to show you some data, but I think I will have to tell them without showing the slides. The first information I want to show with you is that it's very difficult to believe that, but overweight people are not dying more than normal weight people. Actually, there is a lot of information that the association between BMI and total mortality is J-shaped, U-shaped. So when we say that obesity and overweight are a problem, we should be very clear. Obesity may be a problem, is likely to be a problem, especially severe obesity, but a slight overweight does not increase total mortality. So I think that we should be very careful in distinguishing between those two situations. When you say that, when you hear that in Italy, 50% of children in southern Italy are overweight, we should be very careful because 10% is obese, that's a key issue. 40% are overweight, and this is not an issue, actually. The following slide I wanted to show is the crucial one, which shows very clearly to me why the large part of this study is ideological. It's a paper named The Global Burden of Disease, and it shows the first 15 dietary mistakes which are associated to cardiovascular mortality in industrialized countries. And in this 15 list, this is 15 list name, fats do not appear at all. Total fat, saturated fat are not in the first 15 list of mistakes which can increase cardiovascular mortality. Salt is the first, but the situation with salt is changing rapidly. Now we have the feeling that even with regard to salt, there is a U-shaped association between salt intake and mortality. I think we can come back on that if you want in the discussion. What about sugar? In the list of the first 15 mistakes which can lead to mortality, only sugar-sweetened beverages are present, and they're one of the last topics. So the contribution of sugar-sweetened beverages to cardiovascular death is very, very, very small. Why is that the feeling of a high responsibility of sugar in the world more distributed? Because WHO has published this paper in 2015 saying that we should stay below 10% of sugar, and if possible below 5% of sugar, to increase our health. Well, unfortunately, I cannot show the document because WHO itself says that the quality of the evidence on which this information is based is very low, it's very low. It's an association between sugar intake and dental cavities, nothing to do with the overweight and with other kinds of disease. So a very weak information which has been misunderstood by a large part of the nutrition community. Another information which I think I need to share with you is that larger part of the information we have about the relationship between what we eat and our health comes from observational epidemiological studies. And these are very, we are realizing that the kind of evidence we get from these studies is very weak. A very famous study which is carried on in the United States by 30 years, the health professional follow-up studies. I'm really sorry not to be able to show the slide. Tried to compare people drinking 2 or more serving of sugar-sweetened beverages with those drinking nothing at all. And what they observed is really interesting, because people drinking 2 or more can of sugar-sweetened beverages drinks, according to their data, about 800 calories more than those who drink nothing. But nevertheless, if you measure their weight, their BMI, it's absolutely equal. This shows clearly that the basic information of these trials, which is what you're eating, what do you eat, which is then very placed in relationship with the disease and the health, is wrong, because it's very difficult for people to remember what they eat. So the basic information on which nutritional epidemiology is based is very often wrong. So if we come to the following idea, so is it reasonable to tax sugar-sweetened beverage? We have already got some information from Spain, from Chile. I wanted to add that right now, there is no published evidence that reducing sugar intake through taxation has led in any country to a reduction of body weight. Even in Mexico, where the taxation has been already working for 7 years, no paper has been published showing that this has led to a reduction in body weight. And if the paper has not been published, I think we can be sure that nothing has actually happened. So I think that the situation is a little bit more complex than we think. Another paper just published, which I had been happy to show with you, shows that sugar-sweetened beverages are just a marker of a bad diet. And the author of this paper, which is Barry Popkin, who is absolutely not a friend of Coca-Cola and of these companies, is admitting that since the overall quality of the diet is bad in people who drink a lot of sugar-sweetened beverages, it's rather stupid to imagine that just taxing these kind of drinks will solve the problem, because this needs to be approached much more completely. So what can we do? My final message is that the future will say that personalizing our suggestion is the most important thing. We now know that if 10 persons eat the same kind of bread and you measure what glycemia is moving afterwards, you will get 10 different curves, which means that we are not equal. And the response of each of us to a load of starch and of glucose will be different. Why that? Because our genes are different, because our microbiota is different. So I think that in some time we will be able to say to each person what they should do to improve their health. But now we are very, very far away from that. And I fear that 20, 30 years are still needed to reach this point. So okay, what can I say? We have to be very, very patient with that.
Thank you so much, and particularly for the call to be patient. That's something we're trying to be, particularly in this period of time. So we have a lot of patience right now. But very interesting what you said, reporting the studies. And of course, Andrea, since you could not share your presentation, if you want to send some of this information or some of these studies, and many of them are of course available online, that would be great, because basically they demonstrate that the war against this food or ingredient is actually not justified or verified or by scientific evidence. Also, I appreciate what you said about saturated fats, and the fact that we tend to accuse saturated fats, and what we see in Europe right now is lower in saturated fats. That sometimes means also a reformulation of the product with a change in taste. And if we think about young generation, it's like young generation will be used to taste different products, the same brand, but with a different taste, because it has been reformulated, not because the entrepreneur or the business wanted to reformulate that, but because the law, the government pushed these companies to reformulate their products exactly by regulation. So we're getting toward the end, and I want to end with a quick round of recommendation or suggestion in terms of policy, because at the end we need to go back to public policies. Europe is going through a very interesting time with farm to fork, revision of the labeling system and so on. Spain, as we said, is going to introduce probably a Nutri-Score, what Natalia recommended, as these little dots that are very simple in communication, but they can be very dangerous as well. So Chris, what are the political or what are the policy recommendations that we may provide to policymakers in each country, and particularly in Brussels? I know you're out of the EU, but you can still make some suggestion. Huh?
Well, yeah, because the United Kingdom is very much on the front line of all this stuff. We are supposedly leading the way, leading the world. We have a scheme run by the government telling the food industry to remove 20% of sugar, remove 20% of calories, to remove 20% of fat from their products somehow. What they're supposed to replace it with, I don't know. And the government last year announced that it would be introducing a far-reaching ban on advertising these products. I don't know what classical liberals are supposed to propose instead. With the best will in the world, I don't have the answer to obesity. I don't think there is one. I don't think in rich societies, which are reasonably free, you can stop people eating too much and exercising too little. There's just nothing you can do about it. Possibly you can give people more education information. I don't know how much effect that would have, but I can't think of anything else. What we need to be saying, I think, to policymakers is this is not going to work, and it's going to have some very negative, unintended consequences. What we should be saying to the public is this is not about junk food. The campaigners will always use a term junk food. It doesn't have any legal definition. People in their minds, they're thinking American fast food chains, hamburgers, pizzas. But in order to have a law, you have to have a legal definition. And the legal definition in Britain and elsewhere is high in fat, sugar, and salt. Well, how high? Actually, not very high at all. And people soon realize, if you educate them, that we're talking about your local bakery, everything that sells. You're talking about these small shops that you've been buying from for years and years. You're not talking about American fast food chains. And actually, these bans on advertising and these taxes and all the rest of it, it's going to affect most of the food you buy in practice. Most people eat so-called junk food, if we're going to define it by that. And once people realize that, there is a backlash, and we've got a backlash coming in Britain at the moment.
Thank you very much, Chris. Thank you for joining us. Antonio, any recommendation for policymakers, particularly in Spain, where I know with your organization, Civismo, you're doing a big battle to try to educate citizens, to stand up versus what the government is trying to do in a very ideological, as you described, approach?
Thank you, Pietro. Well, it's hard to give some advice to the government in this case. But when most of these measures are pushed by the World Health Organization, and when we go to the documents, when we go to the literature, the recommendations are basically focused on taxation and prohibitions. So it is the World Health Organization, and it acts like the World Tax Organization. I mean, they don't promote healthier ways of life. They don't promote certain kinds of diets. When it comes to attack these substances, they just focus on banning them, on increasing revenues for governments, but they don't actually focus on health or on the citizen. So a recommendation for who am I to do that, but for every citizen is to have a healthier life, but not to listen to some politicians who probably are not focusing on their health, especially when something that is coming from from people who are telling you to stay home at the same time that they are prohibiting or raising taxes on electricity and gas and certain food that is sometimes the only thing you enjoy during the day. So recommendation not to trust them.
Thank you so much, Antonio. We'll probably follow your recommendation. Well, let me remind you that this event is being recorded and we're getting close to the end, and you can rewatch it or suggest it to your friends. It will be available on YouTube on the Austrian Economic Center YouTube page, and on it was well accessible from the Economic Center, Austrian Economic Center website. And we're live on Facebook and of course on Zoom, where we have many followers. Natalia, you said one of the most advanced regulation, and advanced doesn't mean innovative or better, but one of the most, let's say one of the toughest regulation on particularly on food and on labeling as well. What are the recommendations that you gave your government? And you said there is a lack of public review or policy review. Is that true? But I remember you didn't touch on that, so I want to provoke you. I remember your minister said it didn't quite work.
Yes, but that was after a long debate, letters, exchange of letters in the newspapers, after we were able to surpass these politicians that are pointing us with the finger and saying you have an interest, that's why you are defending who has been poisoning our kids for years, because that's the level of the arguments. So we were able, with a group of people and also with the industry, to start making the point in our society that we need to assess this regulation, that we need to evaluate it. And the Ministry of Health took the point and he said, yes, things are not working. Because actually what we citizens want is more information. I want to know what I'm eating. I don't want necessarily more prohibitions. You know, nutritional information is hard to understand sometimes, and we need clearer information. And with that information, what I want to do, if I want to do it, I want to compare and I want to decide my feeding habits and those of perhaps my family until I can, right? And teach them according to the alternatives that appear more healthier according to that information. The current ruling in Chile does not respond to that demand. Instead, I would say it demonizes 90% of the supermarket gondolas. Like the limits are so strict and they get stricter with time that there's a point in which 90% of the food products are going to be having this black seal, which is like a warning not to be feeded by those products. So at the end of the day, that's not information for the consumers. We can't compare. The law forbids any other information that the producer wants to put in the label. Of course, nutritional information is there, but if he wanted to do a comparison, he cannot do it. So my recommendations would be, let's trust the consumers a little bit more. Let's provide them with the tools to choose. Let's give them clear information. Let's give them information that can be usable. I mean, I don't care if something is dangerous in a 100 gram, if I'm eating, I don't know, 30 grams, or if I'm eating 250 grams as a consumer portion. So I really want to know things that are useful for us consumers. And of course, try to pass regulation that will not go at odds with other regulation. Like here in Chile, all these restrictions in advertising, you can really make, and there has been cases about information regarding industrial property rights and trademarks. I mean, let's make regulation compatible and not with one hand protect industrial property and with the other hand undermine it with food regulation.
Thank you so much, Natalia. And one thing that you mentioned that is actually supported by scientific evidence is, and this is scientific evidence, is that when consumers, they find something low in or reduced by, they tend to buy more. So basically the effect is still there. By the way, before getting to the end to Andrea, I just want to remind that there was a study that was released or a consumer survey or behavior analysis done in Italy that consumer choices are changing and the trends are changing quite much. We are moving away from food that are low in and free from into, because of the pandemic, probably in food that are high in or rich off. Why? Because probably because of the COVID, people are looking for something to be added and not something to be taken away. So that's very interesting data that I'm just leaving here for discussion. Andrea, you mentioned something that from a liberal perspective, it's very important: personalized diets. Can personalized diet basically contradict all the political and policy work that there's been done, or somebody's trying to do, some governments are trying to push right now?
It's highly likely that the personalized diet will be completely different, but coming to something we can suggest to government immediately, I think that we should move from what we call a negative diet, negative nutrition, to positive nutrition. The slide I wasn't able to show you from the global burden shows very clearly that it's not necessary to reduce fat, sugar, maybe salt, but it's necessary to improve the amount of vegetables, fruit, fiber, legumes, polyphenols, polyunsaturated fatty acids, omega-3 and omega-6. So I think that the concept behind, for example, nutritional profiles, we say you should not exceed X% of saturated, X% of sugar, X% of salt, is basically wrong, because we know that this is not the key to improve the health of the population. We should say rather improve please your amount of vegetables and so on. And the same is true for front of pack indication. Nutri-Score is focused on what you should not eat rather than on what you should eat. But if I make a very simple example, chocolate. Chocolate is rich in sugar, chocolate is rich in fat, but if you look at the association between chocolate and health, you see that people consuming 20, 30 grams of chocolate per day fares much better than those who consume nothing. And the same is true for cheese. Cheese is rich in fat and salt, but people consuming cheese fare better than those who consume nothing. So we should change completely the kind of information we give, moving from negative to positive nutrition, and then ensure that in this case we will get much better results than as we are doing now.
Thank you so much, Andrea. And getting to the end, I want to thank Professor Visioli from the University of Padua that just made a comment in the question and answer. I see that there was a question by Fishpau. Please write the question, otherwise we are getting to the end. I want to thank otherwise all the panelists. Let me start from Natalia, joining us from Chile, then Chris joining us from UK, Antonio from Spain, and Andrea from Italy. This is an event of the Austrian Economics Monthly that we organize every last Thursday of the month. Next topic will be communicated very soon. Recording of this event will be online very soon as well. In a few hours from now, you can rewatch it. Please share it. Please, our goal here is not to give definite solution, is to help finding solution, that are enhancing our freedom, that are enhancing the way we do rules. And as Natalia said about regulation, the most important thing about education is critical thinking. And what we're trying here is to implement our knowledge by developing critical thinking. I saw that there is a question coming from Saku, and we answered just this question. Is the Nutri-Score similar to the labeling in Chile? I would say Natalia helped me answering this. Somehow, the Nutri-Score is more of a color-based, alphabet-based, how would you say, scale. A or green is good, and down red and E is bad. That's something similar to what you have in Chile, although in Chile is black dots. Am I right?
Yes, I mean, Chile is you're in or out. It's not a gradual scale. Either you comply, and if you don't comply, you're a disreputed food product.
Yeah. And again, it depends, Natalia, how you, and Chris has said before, how you build your criteria, because you have a product E or red, you want your product to be in green. So you're definitely going to take away something, reformulate your product, change the taste of your product, and there will be a work to get to the green. You also mentioned, guys, and Andrea, you mentioned it before ending, really. You mentioned about we need to eat more fruit, more vegetables, but somebody in Europe would say, that's a lot of land that we need. That means less sustainability. So when we think about nutrition, we have also to think about sustainability. This is why one of our series of seminars is called Sustainable Nutrition. It's the balance between nutrients and sustainability. Let me stop here because we got to the hour. Again, thanks Natalia, thanks Chris, thanks Antonio, thanks Andrea. Thanks to Victoria, that was our host, and the Austrian Economic Center in Vienna and Confederate here in Italy, and to everybody that's been following us from Asia to America. Thank you so much. Have a great evening, afternoon, day, whatever you have ahead, and enjoy your time, and please stay safe. Thank you so much. Ciao.